Good morning. How are you doing this morning?
We're live. Okay.
Good morning.
Good morning. How's everybody?
Good morning, everyone. Happy February. I
Yeah.
hope everybody has gotten the chance to enjoy the days. Welcome today to the board and online viewers to the January 8th, 2025 Board of Health meeting from Louisville Metropolitan Health and Wellness. The board meeting is officially called to order at 8 a.m. This virtual meeting is being streamed via Facebook and will also be rebroadcast on Facebook and YouTube. Let's enjoy the couple of days that we have had with sun, and the cold days are coming back again. The December Board of Health minutes were distributed to the board for their review prior to this meeting. Are there any discussions or amendments to the minutes?
I move adoption.
May I have a second? May I have a second to move?
Second.
Thank you.
I second.
Thank you very much. So with this, we move motion approved, and it has been distributed. Regarding the chair's business, I would like to take advantage of this open forum to encourage everybody to get your vaccines. Let's prevent getting sick. For the period from January 19 to the 25th, the COVID-19 current wastewater viral activity levels for the Commonwealth of Kentucky was reported high. And the CDC also reports an increase in almost 30% of the influenza positive tests all over the country, and almost 7% increase in office visits and hospitalizations. But in our city and in our area, this is beyond 30%. One of the healthcare systems has reported almost 48% positive rate for influenza. And just last week, several children were hospitalized due to this. The information is also repeated at the new Louisville Metropolitan Health and Wellness Influenza Surveillance Dashboard that our director has shared with us. And the graphs just show an increased number of cases. And also we are worried about avian influenza. The last report from Kentucky Public Department of Health says that there's no human cases reported in Kentucky. I think it's 68 in the whole country, just one disease, but many mammals have been affected. So we'll just keep an eye on this. Following Dr. Singal's recommendation, and this is a really good topic to learn about this day, our perspective session this month is Community Care Campus, where hope and healing begins. And we will have three presenters. We will have Jennifer Hancock, who is President and CEO of Volunteers of America Mid-States, Natalie Pasquenza, VP of External Relations, and Tamara Reif, Senior Director of Housing Services. Are you here, madams?
Good morning.
Yes. Today I present to you Ms. Hancock, Ms. Pasquenza, and Ms. Reif, the presenters. If you would like to share your presentation, this is the time. You may do so at this time, and I yield the field to you. You have 20 minutes for your presentation, and then we'll have some time for questions. Thank you so much.
Great. I'm not sure if Jennifer has hopped on yet. She was having some camera issues.
Okay.
Natalie, are you there? Natalie,
okay.
Natalie can't get her microphone to work, so we have
the presentation. We have the presentation ourselves. Okay. Do you want us to share it and you can start, or what would you like to do?
Well, we can certainly go ahead.
Jennifer is on.
Is Jennifer there now?
Yep, she is. I see her.
Okay.
Good morning, everyone.
Good morning. Welcome.
Hi, thank you.
So we're ready. Kathy, do you want to share their presentation, or do you want, Ms. Jennifer, do you want to share your presentation?
I think I can do it. I have to admit, part of my struggle this morning is WebEx has not been my friend. So let me see if I can do this.
Please do so.
Great. All right. So let's see if that's working for everyone.
Yes, we can see your presentation. Please go ahead.
Terrific. Okay. Well, thanks for letting us be here this morning, everyone. Good morning. I'm Jennifer Hancock, the president and CEO of Volunteers of America. 4 days ago, I celebrated 18 years with the organization, and I'm really proud to get to be part of this project in partnership with Louisville Metro Government. We're talking this morning about the Community Care Campus, where we see hope and healing has an opportunity to meet and address some of the most critical needs in our community around the issue of those who are unhoused, where we'll provide healthcare, housing, and other essential services. Just a little quick reminder about Volunteers of America. I know so many of you are familiar with us. We are one of the region's oldest, largest, most diverse not-for-profit organizations, founded back in 1896 by volunteer missionaries. And while we have professionalized today and we're an accredited, licensed organization, having been founded by missionaries who really wanted to serve the most vulnerable, that remains deeply embedded in our DNA. Today, we have more than nearing 700 paid professionals across Kentucky, Tennessee, West Virginia, and Clark and Floyd counties, in Indiana. We have 7 lines of service today, and that includes everything from our recovery services, where we're providing evidence-based clinical care to moms who are pregnant and parenting and substance use disordered, as well as other individuals needing substance use disorder treatment. We provide a full array of homeless and housing services, and you're going to learn more about that with my colleague Tamara, who runs all of our VOA Home division. In VOA Health, that's where we're providing community health workers and other public health services like free and anonymous HIV testing to the community, those most in need of public health services. VOA Honor is all of our services focused on supporting veterans as they return home. That's everything from suicide prevention, moral injury services, as well as housing case management and job placement. In VOA Community, those are our services dedicated to individuals who have intellectual and developmental disabilities. And then our last 2 divisions, VOA Justice, those are our restorative practices for youth who are starting to show signs of behavioral challenges or criminal conduct. We're working within the school system and the justice system to support those youth to avoid additional consequences or being entangled in a system. And finally, VOA Work. These are our services devoted to individuals who are needing to return to the workforce or get skilled and trained up so that they can be more self-sufficient and successful in life. So you can see that we have a wide array of services that all of which are connected in some way. We want to see this community care campus as a holistic and integrated service model. So just a quick refresher of the background of how we got here. We responded to an RFP that Mayor Greenberg's office issued in 2023 once the Smoketown campus was purchased and identified as his future development for homeless and housing services. Initially, Volunteers of America applied to do 2 things that we know how to do really well, and that's services for families affected by homelessness. We operate Unity House and have been doing so for 40 years in this community, where we provide professional services, case management, behavioral health supports, as well as financial literacy and all of the services and resources needed to help address the root causes of homelessness. So we responded to this RFP asking if we could expand our Unity House, given the data had shown that there were more unhoused families needing services that were not able to access residential help. And then we asked if we could provide affordable housing on this campus. Just 2 weeks ago, we broke ground on an 80-unit new affordable housing complex Some of those units are going to be set aside for those dealing with persistent and severe mental health issues. And so those were the two components that we wanted to do on this campus. And as Mayor Greenberg's team came back, they asked us to do those two things. And they also asked us to develop and manage the entire campus. And so we entered into an MOU to become the managing partner at the end of 2023. And since that time, we've had a number of town hall meetings to really understand the perspective of Smoketown residents and Old Louisville residents. We've reached out into the faith community, other social service providers in the neighborhood, such as Hope Village and Salvation Army, and began a master planning process that has been led in part by our friends at Miranda Construction, who were selected to be the general contractor for this project. Last year, we also started demolishing some buildings on the site. While some are useful for the new purpose of the community care campus, not all of them are. So we started demolishing some buildings on the campus. And then in November, received funding to be able to stand up a temporary shelter for families while the new structure was going to be renovated and won't be open until later this year. So I think as I was logging on this morning, you all were chatting with my colleague, Tamara Reif, who runs all of our homeless and housing services. I'm going to turn it over to her now so that she can walk you through the site plan and what we're contemplating on this campus.
Good morning. I also wanted to just kind of talk a little bit about what our VOA Home umbrella serves. So as Jennifer mentioned, and I've been introduced, Tamara Reif, I'm the Senior Director of Housing Services. So I oversee all of our housing programs that include services for individuals who are currently homeless, those that we're trying to prevent from becoming homeless, and those that we have been able to move on to longer term permanent supportive housing. So we currently operate a 23-bed family emergency shelter in Smoketown on Preston Street. We've been operating that shelter for over 40 years. We just celebrated 40 years. And we are really excited that part of this plan is to add an additional family emergency shelter that will hold an additional 29 families. So we'll be operating both shelters. One of the things that we do for as part of the VOA Home program is making sure that the families that leave shelter have a safe and affordable place to go to. So we work with them to be referred to multiple places across the city through partners that have funding from Common Assessment, HUD, to do different type of voucher programs from Section 8 to rapid rehousing to permanent supportive housing. So we really do sort of a wraparound care from the minute we get our clients in shelter. We're working with them to move on. We serve only families at this time in the shelter. So our shelter, you must have a minor child to live there. And the same will be true for the shelter on the campus. We know that families experiencing homelessness is a great need. And we believe that, or at least I believe, I have visions that at some point in the future, there won't be a waiting list, and that when families call looking for shelter space, they'll be able to go directly to a shelter. So all that to say, we'll talk a little bit about the plans for the site. We'll start with the right-hand side. If you look at buildings A, B, and C, those are existing buildings. As Jennifer mentioned, we were able to demolish some buildings, and the buildings D, E, and F are all brand new builds. So building A is the Old View Hotel. It's at 822 South Floyd Street. And it is a 4-story building that will be completely renovated from the basement to the 3rd floor, creating 29 family shelter rooms, everybody with their own individual bathroom, which is really a great thing for families to be able to have everything they need in their own space. We'll have space for teens, space for younger kids to play, large kitchen and dining area, and really just a great place that is will provide all of the services that the families are needing, as well as case managers to really make those referrals on. That building is demolition started this week, and we hope at the end of the summer we will be able to open those doors. Going down the B. Do you have a question? I'm sorry, does somebody have a question? Okay.
Just continue, please.
Okay. Building B is a church on the corner of Floyd and Breckenridge that we will be creating a community center space as well as 6 transitional apartments. That space will be able to be used by a multitude of people. Somebody may want to borrow the space or rent the space to have an event in. We will work closely with Louisville Metro Police Department and their Police Activities League to lead different activities in that space. It's going to be a great open space that will just have the ability for people in the community to be able to get together in a safe area to be able to do all kinds of activities. And then the apartments will be dedicated to our graduates of our Freedom House program. So they will come over and be able to live in the apartments that will be on the 2nd and 3rd floors. And then building C is our partner space as well as headquarters. So we have recently sent out a survey asking who would love to have an opportunity to work on this campus or have an office on this campus. And the responses were amazing. There's a lot of people who can't wait to be able to be a part and offer services to clients in this space. So clients that live here, clients that live in the neighborhood will be able to come to see the common assessment team with the family health centers. They'll be able to see somebody from legal aid. Payee services may be on the site. There's a whole host of folks. And then our headquarters will be also in this building and they'll move into this space. Currently, as Jennifer mentioned, we're operating a temporary shelter. We recognize that because the new shelter was going to take a little bit longer, but we were coming up on some inclement weather. We have a building on the campus that is currently being used as a temporary space. It's a small hotel that is sort of in the middle of this parking lot currently. It won't stay. It'll be a building that we will eventually demolish in order to make room for building D, which is the affordable housing project. That is the last of the projects because it takes time to apply for tax credits, secure funding, and then start construction. But this building will be somewhere between 60 and 80 units of affordable housing with retail space on the 1st floor that we are currently exploring what that might look like. We've talked about everything from laundry space to library to training rooms to restaurant and coffee shops and all the things. So we're still really focusing on what that will look like and what we have the space to do. And then directly above that is E, and that is our brand new respite building. Respite care is a great need also. And I think, as Jennifer mentioned, it was kind of one of those things that was expected to happen on this campus, and we wanted to make sure it happened as best as it could. And so we are building a building for 30 respite beds, medical respite beds, working closely with family health centers, U of L and Norton to make that happen. We'll also hopefully have some other amenities on the 1st floor, including primary care, a pharmacy, types of things that the families and individuals living on the campus can have access to, as well as those that are currently living in the respite part of the building. And then straight ahead is F. This is transitional housing for 18 to 24-year-old youth. We will be partnering with YMCA Safe Place. So we will build the building and they will take over a program and operation, and they'll be able to have somewhere between 10 and 20 homeless youth be able to transition from here into permanent housing. So we'll be able to get them off the streets and into a safe place with services directly on the campus, and then they will be referred on to long-term housing for them. And that we'll do the timeline next. If you want to scroll down, we'll kind of talk about what's going to happen when. We also have lots of green space. It was really important to us to make sure that there is a walking area so that people can be outside but still be in a space that feels safe. Playgrounds and sports courts and grass and all the things on the campus so that everybody living there has access to sort of commingle and hang out as appropriate. So that as we mentioned, the Unity House will hopefully open in the end of summer, and we will start probably filling those beds without any problem quickly. Then the partner space will open spring of 2026 with respite happening sort of somewhere around there or soon at the same time. the transitional housing for young adults next summer. And then the community center recovery housing will quickly follow after that. And then the affordable housing would be the last part, and that would be in spring of 2028. And I'm going to turn it over to my colleague, Natalie, who's going to talk about funding and where we are with that.
Hi, everyone. Thank you so much. I apologize. I am in a coffee shop, so if it gets too loud and you cannot hear me, just wave and some of my other colleagues will take over. As we have moved through this project, as it has grown, as we have added parts and pieces and buildings and programs to this project, the cost of the project obviously has increased. And as the more we know of construction costs and what we want to be on this space, the cost has increased. So we are looking right now at a little bit over 58 million for construction, with soft costs adding another 10. So 68 to 70 million is our estimate right now. We worked with our Metro folks and obtained 22.5 million from the General Assembly. That was part of the 100 million from the General Assembly, and 22.5 has been put towards this particular project. Where Tamara was talking about the housing, the affordable housing complex, a lot of that will be funded through low-income housing tax credits, where we will find an investment partner and a developer partner. Some other areas where we will get some funding, we have a grant out to HUD to help us with the permanent supportive housing apartments in that particular building, and some other options for funding for there. You may have seen last fall, we announced a huge $3 million gift from the Humana Foundation. That was our first large gift, and it was specifically capital, and it's unrestricted, which was amazing. So we can use that to be pretty fluid as we have to move funds throughout the project. We have some other gifts, and again, here you see some lists here of those that contain the other gifts. Tamara mentioned, opening the transitional or the temporary shelter. That was specifically because PNC gave us a grant to get that opened. And so a $20 or so million gap is where we are now. We have lots of irons in the fire, and we are looking specifically also to get the business community involved as well. And some of our partners who are going to be on this space also understand they have some fundraising responsibilities to that work as well. As Tamara mentioned, not only do we have the VOA partner space, where we will have community partners who can provide services for our clients on and off the campus, we also have some partners who are helping put this together. So it's hard to not mention these crew, because we could not do this work without them. The Downtown Development Partnership with their ambassador, we are working to find out how those can work seamlessly with this campus. Miranda, of course. Nindel Scott is our landscaping partner. Family Health Centers, U of L Health and Norton Healthcare are helping us on that respite building. The Chancery, we've just now it's not part of this campus, but will help support the work of this campus. Louisville is integral and will be providing obviously lots of the food on this campus. They'll be working specifically in our Unity House, but they will be providing really high protein, high healthy, high healing foods for those folks that are in the medical respite building, as well as maybe even having some of their other food located in other places. Tamara mentioned the Police Activities Lead. LMPD has been integral in helping us use how we design the space itself with landscaping and wayfinding to help us really make sure this is secure but doesn't look scary to folks that live there. So they've been integral in that. They will also have a touchdown space on this campus. They've indicated they've needed a place to go to the bathroom, a place to have some quiet space, to get some paperwork done. And so they will be a partner on this space, and we're really excited about that. LUMED, we're working with Natarica to see how our campuses can kind of combine in a certain way to make sure that our services are flowing correctly. Coalition for the Homeless, of course, and then of course YMCA Safe Place, as they are operating the young adult section. Mute myself, and I'm so sorry for being so loud. And see if you have any questions, and we can see who can answer best.
Thank you very much to our three presenters. Do we have any questions? Board, community advisors? Vice Chair, Ms. Margoli?
Yes, Jennifer, to you and your team, you personally, your contributions to the city have been phenomenal, and to this community as a native here. My hat is off to you. Your team is best practice and are really, really leading collaborative efforts that make a difference. No one can do this alone. And like I said, you are certainly a health hero in this city. And I hold my hand in partnership, although I already am through the foundation, and that work is incredible as well. So thank you.
Thank you, Ms. Margolis. Anybody else? Thank you so much to our three presenters to bringing Volunteers of America up front to our meeting and to let us know what is happening and that you're still working, you're still providing the service. And meanwhile, a huge transformation is going on that will benefit many, many, many members of our community. Thank you so much.
Thank you.
Thank you so very much.
Thank you. With this, we will continue our agenda and allow time and space for our updates and reports. For the mayor's office update, now I yield the floor to Deputy Mayor Nicole George.
Good morning. It was a great way to start the morning back here in the progress with the Community Care Campus. We're all really excited about the work that is currently happening there and the construction work for future service. So that's really powerful. So thank you for letting them present. Couple quick things. We are currently, if you can believe it, underway for the budget planning process. So that work has started with our metro agencies. Also, each agency has identified priorities that they're working with the mayor on. And I see Dr. Single is here, so perhaps he can share some of that in terms of what's planned with public health for this year. Won't steal his thunder. Do want to mention that our external agency funds, those grant opportunities went live at the end of January. We have really worked hard to streamline the process, both in the way of applications as well as what happens when, once awarded, agencies are required to submit reporting. We've also worked hard to narrow our focus so that we're being clear from a metro perspective on what the priorities are. We want the best applicants. We want to make best use of everyone's time. Everyone will remember they're really in three buckets, right? There's the social service bucket, there is the youth serving bucket, and there's also the bucket for the arts. And so within social services, we really narrowed our focus around housing and housing supports. And with really key focus populations, that includes people over 55, people with disabilities, 18 to 25-year-olds. So if you go online, there's an array, but if you could please help us spread the word that this is the time those applications will be open until March the 3rd. So EAF budget planning and priorities are underway. Thank you.
Thank you very much, Deputy Mayor George, for the update. Now we go to the director's update. I yield the floor to Chief Health Strategist Connie Mendel. Ms. Mendel.
Good morning. Thank you. So everyone, all the members should have a copy of our February's director's report. So this provides information for a lot of the work through January. One of the things I wanted to mention is that January was a National Radon Action Month. Excuse me. Unfortunately, Louisville and Jefferson County, we do identify some high levels of radon, and all this is due to the geology under our homes. So radon is it's a gas that results from the breakdown of certain rocks and minerals within the property. It is tasteless, it is odorless, and the only way to determine if you have radon is to do a test. It is the second leading cause of lung cancer behind smoking. So we want to encourage everyone, if your home has not been tested for radon, to do that. There is a link in the test, in the report, that please share that to receive a free radon test kit from our department while supplies last. There's also information about our updated mental health services. Please share that. It is in English and Spanish. So the new brochure just lists those organizations, programs, and other resources for mental health in our community. Really important topic for these trying times, that we do all that we can. There are services available for those that are uninsured or underinsured. Again, there's always lots of information. We have several positions open in the department. We would ask that you share with those looking for a new career to consider joining us. We have a fantastic team. We do great work. Always challenging, but you'll never run into the same day twice working with your public health. So again, if you could share information there with any of your contacts, or you understand anyone looking for a new opportunity. The last two things that are in the report that I wanted to quickly refer to was the House bills. 173, and I think our chair mentioned that earlier. And this is preempting local governments from having rental registries. So Louisville Metro government recently enacted a rental registry and a lead rental registry. Both of these are to ensure that there is safe and healthy housing available for our citizens. So please, consider, reading that material and sharing that, with others. And like I said, I think Madam Chair is going to refer to this later. Lead poisoning is still an issue in our community. We still have children referred to us with elevated blood lead levels. The second bill is one to prevent local government's restrictions on smoking applying to cigar bars. Metro Louisville has experienced a comprehensive smoke-free laws and policies going back to 2007 to include cigars, vaping, and hookah, along with cigarettes and other smoking products in indoor public spaces or businesses. So this would allow for the creation of cigar bars, not only in Louisville, but across the state. So I will let you all review those. And then I will refer to our executive director, Dr. Single, if he has additional information to share.
As Connie said, there's never a dull day, right? which is good in a way. So there's always a lot going on. First of all, I echo what Dr. Bautista Cervera said at the beginning. I think there's such an uptick in flu and COVID. I think we should, as much as we can, wherever we are, whatever spaces we are in, try to promote that and give people an opportunity to ask us questions if they are worried that they don't want to have those vaccines. Flu vaccine has been around forever, and now COVID for the last few years, and has been very safe and can prevent these uh the 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 breakouts that we're seeing in so many places. Oldham County was closed. I think it's closed today as well. And Jefferson County also has the same problem. And we were at Jefferson County Public School System yesterday. Eva is on the call. And you know what, Eva, I'll let you share the good news from yesterday. I think the other thing that I will mention that the opioid advisory board, opioid abatement funds. We have been working with our community partners, Deputy Mayor George and Mayor Greenberg, trying to figure out how can we build sort of a primary prevention muscle in the community, which we feel like is lacking. And that's what's being asked of us, which rightfully so by the Metro as well as our community partners. So Ben Goldman and Kalisha are leading this charge and working with JCPS, and we will be allocating significant amount of money and building an infrastructure within JCPS where we have 100,000 children where we can start that primary prevention. We might not see those results right away where we don't have KPIs to show you, but that's how you build a community. I don't think I have anything else to share, but I'm open for any questions if anyone has any questions.
These are great news. Such a wonderful way of using funds, preventing, and teaching and empowering our kids on how to do wise choices. Thank you so much, Chief Health Strategist Connie Mendel. Thank you so much, Chief Executive Director Dr. Inder Singhal. Appreciate it. Any questions for them? Ms. Margolis.
Okay, let me see. Can you hear me? Yes, okay.
Yes.
This is for Ms. Mendel, and also for Deputy Mayor George with regard to the rental registry, which, as Ms. Mendel knows, has been a priority of ours. Do we have someone who can help with the legislature on this? In other words, the city lobbyists, but I'm happy to make a call to somebody who's very close to Stivers, because I think Stivers could be helpful, or we could have some sort of workaround.
So this is, yes, a very timely question and something that we're working hard on and obviously are very concerned. Both to the impact to the rental registry in addition to the lead registry. So if we think about the health and safety impacts of just quality housing, that's certainly important. And obviously the piece with lead is another layer. I would say a couple of things. One, I wouldn't discourage anyone from exercising their rights civically to connect with their legislators. What I think is important to know is that generally speaking, I think the legislature would like to give Metro the opportunity to address opportunities here before enacting legislation, but it has been made clear from both the filing of the bill in addition to ongoing conversations that if we don't take action, they will. And so there is ongoing work and efforts locally to collaborate. I know Connie has been part of several questions. In fact, we have a brief call after this to kind of touch base, but I guess I would just say I appreciate everyone's attention to this issue. It obviously is very important. At the same time, we want to work in good faith locally because we believe Louisville knows what's best for Louisville. So, and we feel that way for our other sister municipalities. So thank you.
Thank you, Deputy Mayor. We will continue with Family Health Centers. Now I yield the floor to Dr. Bart Irwin.
This is Ashley Shoemaker. Dr. Irwin is in Washington, D.C. today, meeting with our Congress members, and so he was not able to join the call. He did want me to share an update for Family Health Centers and let the board know that Family Health Centers is training staff on what to do if ICE comes to our clinics for immigration enforcement. As you probably know, the health centers, schools, places of worship have traditionally been considered sensitive locations where ICE does not come to conduct immigration enforcement. But that was rescinded on Inauguration Day. That policy memo was rescinded. And so we are committed to our, the privacy of our patients, our duties with HIPAA to protect the privacy of all of our patients. We don't ask questions about, patients' immigration or citizenship status, unless it is for the purposes of determining insurance eligibility. And we strive to be a place that is, welcoming to everyone, who comes into our doors seeking services. So that is something that we are working on as an organization. And then for the Medicaid Coverage Coalition update, I have here in the office with me Family Health Centers Outreach and Enrollment Supervisor, Doris Fairman. She will be filling in for me when I go on maternity leave later this month. So she will be chairing that coalition when I am out. Our next coalition meeting is scheduled for Monday, the 10th at 4 o'clock. We will be debriefing after a very successful open enrollment. I don't have the county level data yet, but statewide, this was the second largest open enrollment in Affordable Care Act history. We had over 97,000 Kentuckians that enrolled in marketplace plans during open enrollment. So we will be, discussing that, and then, plans for, special enrollment periods and what's next on the horizon. Does anyone
Thank
have
you,
any
sir.
questions?
Ashley,
And
I'm
go
sorry.
ahead, Dr. Hedges.
Just seizing the opportunity for a point of clarification. In 7 counties, we've had similar conversations related to the changes in our interactions with law enforcement. The
I'm on a conference call.
one caveat that I didn't hear you mention, because I would say that we have duplicated everything you just said in terms of family health care center, with the caveat that unless, well, it was an ICE, but it's really any law enforcement officer produces a subpoena, a warrant, or court order signed by a judge. That's the critical piece. Signed by a judge. Then we cooperate to the extent that we'll probably notify our legal counsel as well. But the critical piece, and are you following a similar pattern?
Yes, that is correct. That they would need to present a judicial warrant, not an administrative warrant, but a judicial warrant that is signed by a judge.
Okay, correct. Good to see we're all on the same page.
Thank you very much, Ms. Shoemaker. Dr. Ransdell?
Yes, Ashley, is there any resources that are available to give to our workers or clinic administrators that is a guideline of how they should react if an ICE investigation were to occur?
That is a great question. Let me take that back to Dr. Irwin and see what resources we have. I know we've developed our own internal resources. And Dr. Patrice, there may be resources that La Casita has.
Yes,
Okay.
we are
That would be
developing.
wonderful if we could get anything made available or a link to it or anything like that. Discussed this previously, and a certain amount of uncertainty of how or what the reaction should be, or what we can legally do to respond to these. Thank
Yes,
you.
I think what Dr. Hedges has just shared is the first step. We keep our doors closed until we get a court warrant signed by a judge, but I'm sure there's plenty of guidelines for everybody to share. If you have anything written, and if you can get anything written, Ms. Shoemaker, from Family Health Centers, please share. Send them to Ms. Arlana. I'll do the same, and then we'll share, and she will be providing, and we can share, or at least be on the same page on behavior and response for our community. Thank you so much.
Madam Chair.
And best of you. Yes, go ahead.
Yeah, this is Delano from the Kentucky.
She just froze, Miss. I think your signal is not a good signal, Miss Delano. Do you want to type your question or your comment, please? I think we lost her. Wishing you the best, Miss Shoemaker. Thank you so much, and we are looking forward to next month with your coworker. Thank you so much. For JCPS Health, we have now, I yield the floor to Dr. Eva Stone. Dr. Stone?
Good morning. Yeah, so I'll just echo what Dr. Single shared about illness and flu. We definitely are dealing with our share of flu and JCPS. So keeping our nurses and our staff quite busy. The immunization piece, it's we're having cases of flu much higher than we have had in recent years, and it looks like our immunization rates aren't as high. So I think as a community, we have some good opportunity next year, maybe to be a little more in front of all of this. We're also seeing an uptick in COVID, but by far and away, it's flu A that we're seeing. And then Dr. Single mentioned some work that's being done. So we held our first vision clinic. So one of the biggest challenges we have in JCPS is we can identify things, but finding the resources to get them taken care of is a significant challenge. And we've already on this meeting talked a lot about things related to social determinants, and it's no different for the health of our children in JCPS. You all have been a great support in helping us to try and address the very significant disparities in immunization rates for children living in poverty in Louisville, and why that's certainly not an issue for JCPS to fix. It's been something that we've had to rise up and work with our partners to deal with. And same holds true. We have kids every year who 2 years ago, we had about 9,000 students fail their school vision screenings, elementary age kids. And so been working with Dr. Single, who has mobilized resources. And this is our second year. We piloted some on-site clinics last year. Yesterday, we kicked off our first one for this year in partnership with the Adarsh Foundation and VisionWorks. And so we had a clinic at Jacob Elementary School for kids who had failed their vision screenings. And we saw 77 students there. And so these were students that were screened initially with just the Snellen chart. And then we went back with the spot camera and rechecked those kids. So the kids that failed that screening were referred to this clinic or given the opportunity to be seen. We saw 77 students, and 57 of them needed glasses. And so what Dr. Single has done is connected all these resources so that the students will receive glasses at no cost to them or their families. And so at the most basic level, if kids can't see, they're not going to learn. And I think Dr. Single can maybe speak better than I can about the significant need, because we're not talking about minor prescriptions in many of these cases. And Dr. Single, if you have anything you want to add to that.
No, not much, but it's truly shocking, actually. If you guys ever want to experiment, I see a lot of you wearing glasses, and I can see some of the prescriptions. I can tell just looking at your glasses. But imagine, you're -4 or -6 or +4. Try to put the opposite of that lens in front of you and try to look, and you will know how hazy the world is. We had children who were, yesterday we had few children who never wore glasses, and they were all the way up to -8 with some astigmatism, but never wore glasses. So I don't even know how these children are able to read. So I would say out of the 57, half of them, there's just no way those children will ever be able to perform. The other half is the quality will be much, much better, and they will probably not get headaches and enjoy reading. But the half, I just don't even know how. So this is such a wonderful opportunity for JCPS and all of us to help. And children don't have to worry about paying anything to families. If they have Medicaid, then we charge the Medicaid, which covers the cost. If they don't have Medicaid, then we fund the JCPS Foundation, and then we pay through JCPS Foundation. So it's all taken care of.
And if I can add, you know, just one of the things we experienced yesterday was a child who had glasses, but when they checked her glasses, they were over-the-counter reading glasses. And this is not the first time that we've encountered this in these clinics. And so she had a pretty significant need for prescription glasses, and she was getting by on wearing readers. And was very attached to those readers. They were very important to her. And again, this is not the first time that we've seen this in these clinics. We've also several times talked to children who are sharing glasses with siblings. And so this is so significant. And so I cannot, this is a huge public health win, in my opinion. And we couldn't do it ourselves. And so I'm really grateful. And I think it's going to make a big difference.
Thank you so much, Dr. Stone. Thank you so much, Dr. Single, because those actions make a difference. And you know, we are really grateful, and let's support the mission of JCPS and the mission your foundation is doing with these kids. Thank you. For Dr. Batia is absent today, and for the Kentucky Nurses Association, Ms. Delanor, are you back? Can you participate? She has shared that the American Public Health Association has some guidelines available on their website. So this may help Dr. Ransdell, Dr. Hedges, with how to proceed. And also regarding vaccination, yesterday at the Kentucky Public Health Department shared that the vaccination rate for flu in our Commonwealth is only 13%. So that could explain, you know, why we are having what we're having. So we're still community, all of us that can go out and work with the community. Let's share with everybody it's not too late. We still have 2 more months at least of cold, and we can still make a difference with flu, COVID, and vaccinations and our RSVP in case it's needed. Ms. Delanor,
Can you hear me?
participate? Yes.
Yeah. Oh, wonderful.
Now I'll yield the floor to you.
Thank you very much. Dr. Stone and Dr. Engel, your report was just phenomenal. Gave me chills, and it excites me. So the Kentucky Nurses Association, we're doing our Nurses Day at the Capitol on Thursday and meeting with legislators. And really, we have 4 priorities for this year, and that is to tee up legislators to give us money in the budget year for sexual assault nurse examiners, for education for them, continuing to work on staffing for nurses, to have adequate staffing in any area where nurses work, teeing the legislators up for money for school nurses. We are fortunate because of Dr. Stone that we have school nurses in Jefferson County, but a lot of our other rural counties and cities do not have school nurses in every school all day, every day. So we'll be focusing on that. And of course, our big thing is brand image of nursing, in that we do have a nursing shortage. And part of that nursing shortage is that nurses are not seen as, while the Gallup poll says that we are the most trusted and most ethical, the individuals who might consider nursing as a profession do not see us as a profession that they want to join. We also have an education program, social justice, on access to care for those with disabilities. That'll be March the 6th. We have some supplies left from our activities with vaccination clinics, our mobile missions at the office. So if anybody has need for gloves and gowns and face shields, just give us a call. I think, the one big thing, and this has been a conversation with nurses who are calling and asking, now that there is a focus on not discussing and having education that focuses on diversity, equity, inclusion, and social justice, what is the Nurses Association going to do nationally and in the state? And I remind everyone, we have a code of ethics, and code of ethics focuses on diversity, equity, inclusion, and social justice. We will not be changing our focus on education and support based on any political decisions that are made in the United States. So, should anyone ask you, so what are the nurses doing? Now you know. We stay with supporting diversity, equity, inclusion, and social justice as part of who we are as nurses. Thank you. I yield the floor back, Dr.
Thank you.
Bautista.
Thank you very much, Ms. Manson. We have a representative for Greater Louisville. I know Mrs. Somerville. It's not Somerville is not available. We will continue. For our committee reports, now I yield for Immunization Advocacy Committee. I yield the floor to Dr. Ruth Carrico.
Good morning. Good morning. Yeah, absolutely. We continue to see issues regarding access to vaccines and vaccination. And in our committee, we're focusing on how do we provide basic bits of education, primarily to providers who may not be aware of information regarding differing vaccines. We focused on, do we have information regarding where people can go for vaccines? And I know we have it's a comprehensive, but it looks like a short list on the Louisville Metro Public Health and Wellness website, giving the hospital systems and then kind of the catch-all for go back to your provider. And, we continue to recognize that as a weakness, that we just simply do not have the level of communication we would like to have between providers and patients, where that conversation about vaccine confidence and vaccine safety can occur. So we're trying to get basics, just very concise pieces of information, education out, and then trying to figure out the best way to do that.
Thank you very much, Dr. Carrico. Regarding all business, let's talk about Dr. Ransdell's concern about the banning of fluoride in water. Our executive administrator has found a couple of FQA lists that we will share with him, and then we'll work with him in order to bring them to the table. So we'll make them available for the rest of the community very soon. And on the next business, on January 25th, I share a couple of letters requesting your support, board members and community advisors. And these letters, as our chief health strategist mentioned, are in regard to file bills preempting our local health regulations. And these letters are in support of the work our local Louisville Metropolitan Health and Wellness is doing, in regards of the betterment of the whole public health for the community. So if you please, I would like to know if anybody has anything against these letters, or if you are not supporting these letters. So far, I have, I think, 5 or 6 people that have shared and voiced out their support. Is there anybody, board member, against the letters? Because we're going to send them on behalf of the whole board, not only on behalf of the chair. But I want, everybody's support and at least the vocal approval of the letters. Anybody against the letters? Please say it at this moment.
Dr. Bautista, this is Delano from the Kentucky Nurses Association. Did you not get my sign-ons? Did I forget?
I got yours. Yes,
Oh,
thank you. I'm
thank you.
counting on that one. Thank you.
Oh, okay, good.
Thank
I
you
was
so
going
much.
to say,
Appreciate it.
I just wanted to make
No.
sure that I did what I said I was going to do. Thank you.
Oh, no. Thank you so much. Since I have heard no amendments or any rejections to the letters, we're going to send the letters as they are with the support of the whole Board of Health from Louisville Metropolitan Health and Wellness. And please contact, yes.
This is Karen Haskell. I think that I don't have any objections, but I think that since you're sending it out on behalf of the board members, that appropriately we would need to have a vote and have it documented in the records that the board did indeed approve this representation on the part of all the board members. So with that in mind, I would make a motion to approve
To-
those letters and to distribute those letters on behalf of the board.
Thank you so much, Ms.
I
Karen.
second. I second.
have-
This is Eleanor.
I have 2 seconds. Do we have any oppositions? Since none is counted, we move to approve and send the letters on behalf of the Louisville Metro Public Health and Wellness Board of Health. Thank you, Ms. Karen. Appreciate it. Thank you. So please contact your legislators as individuals. Let them know of what you think. And this is important for the public health of our community. I want to thank everyone for participating today, taking time from your busy days. The next meeting will be held on Wednesday, March 5th, 2025 at 8 a.m. This will be a virtual meeting. We were thinking about having an in-person meeting, not just yet. We are just waiting to see, how everything and the climate is going. And we will continue monitoring the weather and everything else. So for this time, March 5th, it's going to be only virtual at sharp at 8 a.m. And if there is no further business, this meeting is officially adjourned. Thank you very much. Appreciate it. Have a beautiful day. Thank you.